Don't mess around with, don't mess around with, don't mess around with cocaine. Ba-do-do-do-da-da-dee-dee-dee-dee-dee. Don't mess around, don't mess around, don't mess around with cocaine. Don't mess around, put the coke down. Don't mess around with cocaine. Don't mess around, it's gonna bring you down. Don't mess around with cocaine. Don't mess around, don't mess around, don't mess around with cocaine. Don't mess around, put the crack pipe down. Don't mess around with cocaine. Don't mess around, put the cocaine down. Don't mess around with cocaine. Don't mess around with cocaine. Don't mess around with cocaine. Don't mess around with cocaine.
Hello and welcome to Our Experts Podcast. I am Carol Matichka, your host, bringing you fascinating perspectives from the world and realm of pharmacy. Today we have with us Dr. Joe Spillane, who is a toxicologist. He works in the emergency department of a very, very busy emergency department. We see a lot of different things, including substance use disorders, overdoses, etc., here at this emergency department. And I've known Joe for many, many years. He has taught in the space of substance use disorders over the years, not only here, but down in South Florida as well. Such a great asset to our community, has provided presentations throughout here as well as South Florida to communities, students, pharmacists, physicians, all sorts of people. So I just want to say welcome and thank you for coming on the show today.
Well, thanks for having me. And despite the fact that you've known me for this long, you still want me on.
Yeah. Can you believe that? It's crazy. No, we really, really appreciate it. So is there anything else in your background you want to share? Something maybe they'll be interested in hearing about? I know we're talking about cocaine today, but...
Right. No, I've been a pharmacist for over 30 years, and I've worked in emergency departments for about that long as well. And I guess my main focus is the acute toxicity of cocaine. I mean, cocaine's a fascinating subject, and we'll talk about other things, but that's the main thing that we see.
Okay. Yeah, perfect. Especially here, right? Cocaine, right. I've heard it before. You've said cocaine is king, at least in our area where we are, but okay. So tell us something interesting about the history of cocaine.
So cocaine does have a fascinating history. It's not just, you hear about the cocaine glamour movies, and there's certainly plenty of them. But it goes back as far as even before the Incas in South America. Cocaine was archaeological finds have shown that. In addition, cocaine was... Sherlock Holmes had a cocaine habit, which a lot of people don't realize. And then he got tired and wasted and became paranoid. And eventually they switched it over. I guess Sir Arthur Conan Doyle, the author, switched it over to a pipe, and he came back much healthier and everything. But that's interesting.
Interesting. I didn't know that. Yeah.
Yes. Robert Louis Stevenson wrote Dr. Jekyll and Mr. Hyde in 6 days on a cocaine binge.
Oh, wow.
And there's a pharmacist who, John Stith Pemberton, who actually invented Coca-Cola with the combination of caffeine from the cola nut and coca from the coca plant. And, of course, that's a $300 billion company now. So
yeah, did pretty well with that. And that's interesting. How long did they have cocaine in there, by the way?
Yes, not very long. I think it was about
enough
10 or 15 years.
to get everybody addicted. And
that's right. And now everybody's, But I think it got decocanized in like 1903 or 1906 somewhere. So it was only a few years, and now it's been decocanized. I like that,
decocanized. I've heard that. All right, interesting. Tell us a little bit about why cocaine matters now. Why are we concerned about cocaine?
So it's interesting because we're kind of hopefully at the tail end of an opioid epidemic, fentanyl and fentanyl analogs, and prior to that it was prescription drugs, and prior to that it was heroin. So we're really at the tail end of a 20 or 30 year opioid epidemic. Mm-hmm. And typically what happens is after an epidemic with downers is followed by an epidemic with uppers, stimulants such as cocaine. Now, cocaine never went away, and in fact, right now, it is fifth among all drug-related ED visits, so still very common. And in the state of Florida, it's the second most common cause of death. So I think it's a big issue now. It has been. And the other thing that I find fascinating about cocaine is that a lot of important concepts about drugs of abuse in general are manifested with cocaine and cocaine abuse.
Okay, interesting. So how does it work? Tell us the mechanism of action.
So cocaine really does some pharmacological wizardry with the. I guess depending on where you're coming from or how early you are in the addictive process, it could be pharmacological witchcraft too. What happens is it inhibits the reuptake of norepinephrine and epinephrine, and that kind of gives the stimulant effect, and that's what people want is a stimulant. So that they can continue to party and so forth. But I think the real reason why people abuse cocaine is because of its pleasurable effects, it's the euphorian effects, which is really a matter of increasing the amount of dopamine in the synapse, which is done by blocking the cocaine transporters. And that's really, but what's really happening is we're kind of hijacking the reward system. The reward system in the brain is set up. It's such a wonderful thing. It's set up for us to continue behaviors that help ensure the survival of the one person, but also to ensure the survival of the species. And then cocaine kind of hijacks that whole thing because there's certainly nothing about using cocaine that ensures your survival. In fact, exactly the opposite. So.
Yeah, that is fascinating. So how do people abuse or misuse cocaine, if you will? So, not really misuse, it's really abuse.
It's abuse, yeah. So cocaine is typically snorted or smoked. It's not usually taken orally because the bioavailability is just not enough, usually around 30% or less than 30%. So you're losing a lot of money by taking it orally, and it's a slower onset. When it's snorted, the bioavailability increases, and it goes as much as 60%. So that's the typical way it's typically snorted, the cocaine powder. Now, one of the quote unquote disadvantages of the cocaine hydrochloride powder is that you can only snort so much because you're vasoconstricting. It's a vasoconstrictor. So no matter how much you put up your nose, you're only going to get so much.
Right.
However, there's no such problem, quote unquote problem, with smoking cocaine. And so there's two forms that can be smoked. You can't smoke the powder because it's destroyed upon heating. But there's two forms of cocaine that can be smoked. One is freebase, which is really a very, very pure form of cocaine and a very effective route of administration, effective that it gets to the brain very quickly.
A little bit dangerous, though, right?
Extremely dangerous in two ways. One because you're getting a lot of drug right away to the brain. Mm-hmm. Two, because in order to make freebase, we don't get a lot of people using freebase anymore, at least not in the ED. But in order to make freebase, you usually have to use some type of organic solvent. And then you're heating that, it's volatile, explosive, and you can hurt yourself that way.
I'm trying to remember, who was the famous person who...
So Richard Pryor.
That's right.
That's exactly how he did it. Back then, cocaine was considered the champagne of drugs, and you had to have a lot of money because it is pure. It's relatively pure, freebase, and it's a very effective route of delivery. And the problem is the organic solvents. Mm-hmm. Now, that's been improved upon in the 1980s in that there is a form of cocaine that has all the impurities that all cocaine have, but it also is smokable, and that's crack cocaine. And crack, the reason why crack is became very popular and so addictive is because it was cheap. It's got all the adulterants in it, so it's cheap. And the other reason why it's so addictive is because by breathing it in, the lungs are so richly perfused, it goes right up to the brain. You get an immediate euphoric effect, which is followed very rapidly by a dysphoric effect. And so you're constantly chasing the next high and so forth. So it's extremely addictive and available, and that leads to toxicity. And that's one of the...
And don't you find it interesting? You talk about cocaine being the champagne of drugs, and then we look at crack. And unfortunately, it's just this completely different animal when people talk about them, and it's all cocaine. Like in the end, it's all cocaine.
That's right.
I think it's just interesting though.
It's been demonized. Crack cocaine's been demonized. If we could find a way to demonize other forms of other drugs, but for some reason, crack, which all forms of cocaine are dangerous, and crack may be particularly dangerous, but still,
Right. Do you see many people injecting cocaine?
Not that often, although you could. The cocaine hydrochloride can certainly be solubilized and injected, but crack is the onset is basically similar to the onset of IV, and of course IV you have to
the needles.
Yeah, that's right. You have
all
to,
that.
That's right.
Absolutely.
Exactly.
And do we ever see cocaine? There used to be cocaine in hospitals. We'd use them mostly for eye surgery, right? Is that still even a thing?
Yes. Now we have cocaine in the pharmacy, but we don't have it in the ER. But many ERs have it, and they use it for epistaxis, to stop the bleeding, because it is an anesthetic that is vasoconstrictive. So, the combination that you hear about all the time is lidocaine and epinephrine. Well, cocaine is a combination of both. So yes, it actually is used that way.
Interesting. So how does cocaine affect the various vital signs? When you're working in the ED, you see them come in. What do you see?
So it's a stimulant. So all 4 vital signs are going to be increased. So increased pulse, blood pressure, temperature, and respiratory rate. So it would be unusual for somebody. It does happen sometimes. People come in with cocaine washout, and they may not have that typical sympathomimetic effect that you would see with cocaine. But those are the major disturbances in vital signs. It's a stimulant, so you would expect an increase in all vital signs.
I would imagine, though, with how much fentanyl we're seeing in all sorts of things, that somebody might say they come in and they've used cocaine, and then every once in a while you're seeing some of that respiratory depression that we'd see, for instance, with fentanyl.
That's a great point, because when people say they take cocaine, they say they took what they thought was cocaine, or maybe they didn't think, but certainly fentanyl is one of many adulterants that are put into the cocaine supply. So absolutely, somebody may say they took cocaine and then respond to Narcan. Doesn't mean they didn't take cocaine, because the cocaine is often adulterated with fentanyl and fentanyl analogs.
Yeah, understood. So what are some other important clinical effects of cocaine?
So the cocaine is a classic example of a sympathomimetic. So we talked about the vital signs, and in general, you're hyperstimulated. So just active is one thing. Hyperactive is another thing that we often see. So somebody who is alert and aroused, and the natural extension of that is hyper alert, hyper aroused, and to the point of suspicious, and eventually paranoid, and then violent. And that's typically, and then the furthest along the continuum of that stimulant pathway that we see with cocaine would be excited delirium, and of course that's a potentially fatal situation.
Gotcha. And speaking of fatalities, what are the major fatalities that you see with cocaine? Yeah,
so that's a great point, because a lot of people don't realize hyperthermia is a huge issue with cocaine. I mean, there's many ways to die with cocaine, including aortic dissection and cardiovascular collapse. Cardiovascular catastrophes, stroke, etc. Cocaine does all that. Seizures, etc. But hyperthermia, if you look at deaths from cocaine, hyperthermia is involved in a way disproportionate amount.
Oh, wow.
It's interesting how cocaine works, because it vasoconstricts so that it generates heat, just because of the activity generates heat, but it also increases the thermostat by its effects on dopamine and serotonin. So you have 2 reasons to be hot, and then you can't dissipate the heat. Because you're vasoconstricted, you can't get rid of that.
So what do you do?
Yeah, that's the problem. And so one of the major treatments in emergency departments is cooling, and cooling, in studies in animals, cooling was one of the few things that actually provided some type of mortality benefit. So hyperthermia is important when we talk about cocaine.
I've heard a lot too that if you see a young person come in with a heart attack, I don't know if you're still seeing this. That's one of the first things you'll try to look at. Is there any kind of stimulant on board, like a very young person?
Yes. So if you look at it, over a quarter of all MIs, myocardial infarctions, that in people less than 40 years of age is cocaine associated. So certainly that's an issue, and it's certainly something to do. People come in with chest pain all the time from cocaine, and it's relatively rare that that it ends up being a myocardial infarction. There's a lot of reasons to have chest pain, and many of them are cardiac after having used cocaine, but it's relatively rare, but it certainly happens. And in a young person to have, a cardiovascular catastrophe like that, many times it is cocaine induced.
Mm. Well, thank you for that information. And you talked a little bit about how we treat in the emergency department, especially with the hyperthermia. So I'm assuming if they're coming in with an MI heart attack, you would treat them just as we would with any heart attack, correct?
Yes, in general, yes. But one of the big things that about cocaine, the major treatment of it is benzodiazepines. In toxicology, in clinical tox, what we usually say is benzodiazepines is the hammer for all the nails. And it's not really true. That's an overstatement, but it really is true with cocaine. It's a hyperadrenergic state, and if you can give something like a benzodiazepine, midazolam, something like that calms them down, it helps in so many ways, because it can bring the blood pressure down, which may lessen your chance of an MI or a stroke. It can reduce your chances of having a seizure or treat a seizure. Mm-hmm. It can calm the person down, so you're not at risk for hyperadrenergic excited delirium, and and even hyperthermia. It's well worth giving benzodiazepines to calm them down. So benzos, when you think of cocaine, the first thing to think about is benzos.
Okay, gotcha. And then, are there any other important issues that you want to talk about? We got a couple more questions in regards to cocaine and something that might be helpful for people.
Well, one thing is that, and you touched on it earlier, is adulterants. So, and this is true with all drugs of abuse, is you have no idea what it is that you're taking when, there's no quality control, there's no FDA approvals, there's nothing like this.
Right.
And so you have no idea what's in there. And we know some of the things in there. We mentioned before is fentanyl and some of the fentanyl analogs, and that's one problem, and it is a big problem. But there's also a variety of different stimulants, including caffeine, amphetamines, you name it, any type of stimulant that will help provide that stimulant effect, but it's cheaper, is going to be thrown in there, including strychnine. Yeah, it's all about money, including strychnine, which is really a rat poison.
Wow, yeah.
I mean, that's been in detected in cocaine samples. We had a situation several years ago of levamisole being put in. Levamisole is a deworming agent that was taken off the market because of its propensity to cause neutropenia. But no problem with throwing it in the cocaine supply. Yeah. And in fact, at one point, 70% of cocaine was adulterated with levamisole. So obviously it was available, and they throw it in there, and people were having neutropenia and variety of mouth sores and
Are you still seeing that or no?
I think it's leveled off a little bit. There's a little less of that happening, but certainly whenever anybody puts, we never know what's in there because they don't know what's in there.
And we're seeing xylazine in like fentanyl, heroin, if it is heroin.
Exactly.
Do you ever see that in cocaine?
Xylazine can be thrown in there as well. I mean, an alpha blocker. So, I mean, certainly anything like that could be thrown in. Typically, xylazine would actually drop your blood pressure, and cocaine does the opposite. So I don't know, pharmacologically it would make sense. But if it makes sense economically, that's when
right.
people are.
It's all about the money.
It's all about the money. Yeah. So.
And I know mixing cocaine with alcohol as a deadly metabolite. You want to talk about that?
Yeah, that's a great.
Or at least
point.
a very dangerous metabolite.
Yes,
yeah.
So that forms cocaethylene, and it's a common. It's a common co-ingestant. People who. First of all, cocaine is commonly abused with other substances. Like 3/4 of the cocaine cases have something else on board. And typically alcohol, cannabis, and amphetamines are typically the main co-ingestants. Right. And alcohol plus cocaine forms cocaethylene. And the issue with cocaethylene is it increases your risk of neurotoxicity, convulsions, and also increases cardiac toxicity. So it's interesting. But people like it because it gives them a little bit of a smoother high. You're taking a stimulant and a downer, and it gives them more of a smoother high, and that's why people take the combination. But it's dangerous.
Was that the Jim Belushi? Was that what he overdosed
Yes.
on?
Well, I'm not sure if he might have taken opioids as well. He may have taken cocaine plus opioids. I'm not positive. But
is that a speedball?
Speedball,
is that what they call
speedball
them?
is, and some people call speedball cocaine plus alcohol, but typically cocaine plus opioids. And I'm not sure about Belushi, but I think he might have taken opioids as well.
Gotcha.
So.
Yeah. It's unfortunate.
Yes.
It's really unfortunate. So where does cocaine come from?
From the slopes of the Andes comes a coca leaf, and chewing gives a little jolt. But isolate the active cocaine, mister, and it hits like a lightning bolt. That's one drug to be aware of. It's a toxin in a toxic sauce. And sometimes they smoke it and sometimes they snort it, but they're always paying awful cost. Just because. Yeah, just because. And they say you don't mix benzos and booze. You don't try to fool your brain. You don't trust the drugs that sell on the street, and you don't mess around with cocaine. Ba-doo-doo-doo-da-da-dee-dee-dee-dee-dee. Don't mess around, don't mess around, don't mess around with cocaine. Don't mess around, put the cocaine down. Don't mess around with cocaine. Don't mess around, put the crack pipe down. Don't mess around with cocaine. 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 So cocaine comes from, it's actually from South America, and it's comes from a plant called the Erythroxylon coca plant, and it's made, and eventually using numerous solvents and so forth, it's eventually made into a coca paste, and some of those solvents include nitric acid and gasoline, etc. And then from coca paste, it's made into a powder, and the powder is eventually made into crack or else sold as the powder on the streets. So
it's crazy. I've seen the production of cocaine in the past, and I'm like, oh my gosh, putting that stuff into your body, and from going to the coca leaf to that is just. It is
interesting how that little plant in South America has fueled a huge rise in addiction.
Yeah.
So.
Yeah. And it was used for years, just people chewing on it, and just a mild stimulant, and then you can take it and put in gasoline and all sorts of things.
Yeah, now it becomes in fact, people talk about the difference between riding on a donkey chewing the leaves to riding on a supersonic jet. Right. It's a huge difference because of its effects on the reward system and our normal neurologic pathways. So.
And this is off topic, but I have concerns. Marijuana, same thing, starts as this plant, and the stuff that they've been doing to it, and now they're pulling it out. We're seeing all kinds of crazy stuff. Yeah, it's getting
more and more concentrated.
Absolutely.
And then that's a little different than just the phytochemical,
totally
just
different.
the plant.
Yeah. Well, is there anything else you would like to share with us today?
Well, one other interesting thing about cocaine is body packers and body stuffers. And a body packer is somebody who, in an attempt to smuggle drugs into this country, swallows a bunch of packets of cocaine. Then they defecate it out, and that's the cocaine that that people use on the streets. I always bring that up because I think people glamorize drugs of abuse. It's this great adventure, and it's not quite as much of an adventure when you feel like somebody's digging through their feces to get the drugs out that you're about to snort up your nose.
Not the picture you want to think about. Right.
You know, so. And basically the treatment with that is going to be go lightly. They just have to basically, poop it out and go on. But obviously if one of them breaks, it is potentially lethal.
Right. And then what's a body stuffer?
So a body stuffer is somebody who, in an attempt to avoid apprehension, they see a cop and they have some cocaine supply, they swallow a bunch of that. And the difference is those packets that people swallow in an attempt to smuggle into the country are not well absorbed unless they break open. But when you just swallow a bunch, then you have the propensity to absorb. And I mentioned earlier, cocaine is not well absorbed orally. But when you're taking a huge amount, now you have an issue, and it's potentially lethal that way. So that's a body stuffer.
Gotcha. Well, that's really helpful. Good information. Thank you for sharing everything. We really want to thank you for coming onto the podcast today. I think this is awesome. I do want to put a shout out, especially for our Northeast Florida listeners. Dr. Spillane's going to be with us at our next Duval County Pharmacy Association meeting. That's on May 15th, and he's going to be talking about cocaine more extensively. I think that's going to be amazing. We're looking forward to that. And we really appreciate your support. So please don't forget to subscribe to the podcast, the YouTube channel. And thank you all for listening. And thank you to you for coming on as well.
Well, thanks for having me.
All right. Take care, everyone.